is a virus that affects the skin, brain, eyes, respiratory, and intestinal organs of dogs. Though it is a highly infectious disease, it is entirely preventable by vaccination. Dogs of all age are at risk, though it mostly affects puppies under the age of 6 months. There are ways to recognize the symptoms so you can get your dog treated. Recognizing acute symptoms. Look for respiratory tract signs. The first symptoms usually affect the respiratory tract. Your dog may sneeze, cough, or have thick mucus in his nose. Your dog may have labored breathing if the infection is in his chest. Oftentimes, the dog will develop inflamed and infected nasal passages, which causes snotty nasal discharge. 2, 3. Dogs with poor immune systems may develop pneumonia soon after becoming infected. 4. Inspect the dog's eyes. When a dog has distemper, her eyes usually have a thick mucus around them. This could look like a gummy, sticky discharge. Eyes with mucus and a snotty nose in a dog not vaccinated more than likely points to distemper. Check for a fever. Distemper can be accompanied by a fever. The fever is usually extremely high, over 103.5 degrees Fahrenheit or 39.7 degrees Celsius. Look for a lack of appetite. Dogs with distemper may stop eating. This may be caused by the fever or because they feel unwell. They also may stop drinking, which can cause dehydration. Dogs may suddenly start vomiting or have diarrhea shortly after becoming infected. This can also lead to dehydration. 8. Check the dog's pads. Distemper can cause abnormalities to the pads of the dog's feet, like enlargement or thickening. Be careful when you examine. The pads may be tender and he may snap at you because of the discomfort. You may notice pad abnormalities weeks or even months after becoming infected. Look at your puppy's teeth. For puppies who have not received their adult teeth, distemper can affect their permanent teeth. The adult teeth can be weak or misshapen because the enamel doesn't form. This is also a symptom that may arise in the later stages of distemper. Be mindful of more severe symptoms. In more severe cases, or in later stages of the disease, the virus can attack the dog's bodily systems, especially the nervous system. This can lead to seizures, fits, hysteria, and paralysis. Know that some symptoms may overlap with other conditions. Many of the symptoms are nonspecific, which means that other conditions apart from distemper can cause similar signs. Usually dogs with distemper are extremely ill. If you are unsure, take your dog to the vet immediately. If you see any of these symptoms and you did not vaccinate your dog, see the vet immediately.